by AstraZeneca. Today, our discussion will focus on the long term implications of RSV infections. RSV often presents with symptoms similar to a common cold in infants, which can be easily misjudged as a minor issue. This sometimes leads to delays in treatment, creating the potential for severe long term health complications for your baby. We are honored to have Dr. Gopal Agrawal with us today, who will shed us light on this very important topic. It is a pleasure to have you here, sir. Dr. Agarwal is a clinical director of pediatrics and neonatology at Cloud9 Hospital, Gurugram, and he has an impressive career spanning several years. He specializes in the care of extremely premature babies in the NICU. Dr. Gopal Agrawal is an MBBS, MD Pediatrics, and DM Neonatology. With over 18 years of experience, he has 25 research publications in international journals and books. He has received several awards and accolades, including Young Researcher Award as at Epic. So, my first question to you would be how does RSV affect a child's development, particularly in the early years?
First of all, thank you, Mark, for inviting me and having me here to discuss this important topic. Um, to answer this question, I would say the burden of RSV is huge. If you talk of actual burden in Indian settings or in developing countries, it's very difficult to estimate because we don't test each and every infection or disease epidemiology. So it's very difficult to underestimate or overestimate a disease. But yes, data which we have from the developed countries, we can extrapolate and can be very pretty sure that we are dealing with in our community. If you talk of our own practices and NICU settings, we normally do for RSVs for patients to us with respiratory illnesses. So we get very RSV commonly in our settings, and we see lots of admissions, babies who were discharged from NICUs, very preterm babies coming back to us with illnesses. So I can say the burden of RSV is huge. And if you talk of data, the huge US data which says that almost nearly 50 to 60,000 babies, infants are actually admitted per year in different hospitals with RSV. And I would say there are like almost 0.03. So almost every 3 baby out of 10,000 admissions actually has a risk of death. So I would say the burden is huge, and every admission, every illnesses will affect the baby's growth and development. If you just forget the data, you see whatever infants or babies less than 2 years present with pneumonia, RSV is the second most common cause of pneumonia in such settings. So this is very common, and it impacts the growth, it impacts the development, it impacts the parents' leaves and work days. I think the pay scale also, and in a way sometimes it impacts the economy and cost also. So I would suggest RSV has a huge impact on babies, particularly preemie babies, and has an impact on the whole family.
Sure, definitely. My next question for you would be what are the potential long term effects of an RSV infection on a baby's health?
See, for last I think 4 to 5 decades, people have been chasing RSV infections, and people have been looking into the not only the short-term impact but also the long-term impact. Just to discuss few short-term impact, a baby who has been discharged from NICU after long stay, if they acquire or contract RSV, they have the very high risk of readmissions to NICU or PICU, pediatric ICU. They have the very high risk of getting intubated again and ventilated, putting on ventilator, and again the cost will have an impact on the babies. And each of this episode will have an impact on the long-term outcome. So what people have seen, they've seen that if you talk of evidence, there's good publications. Way back 20 years back, there was a publication in Lancet which showed that uh, kids who have contracted RSV during their early childhood, less than 6 months of age or 1 year of age, less than 1 year of age, they have chances that they'll be a wheezer. Kids who wheeze during uh, various illnesses till 4 5 years of age and maximum till 6 years of age. They've also shown that there are various studies that have shown that asthma actually worsens or there is increased incidence of reactive airway disease with babies who have contracted RSV during infection. Although causality has not been proven, but there is association of RSV infection with such illnesses. And babies who had RSV infection during early childhood, very likely they'll be requiring some bronchodilators or increased cough syrups till almost 6, 7, and maximum till 10 years of age. So, definitely, uh, the whole logic is that avoiding contact with RSV infection, or else the kid is at risk of later illnesses. The whole
Definitely.
scientific mm, postulates, once one can postulate that there'll be some immunity tweaking happens, which modifies the baby's airways, which again puts the babies at risk of various illnesses like wheezing, reactive airway disease, asthma, and all that. So I have seen lots of such cases in my practice, and we know that there's an impact in the long-term outcome also.
Sure, definitely. Next question for you would be: how does the age at which a child contracts RSV influence the likelihood of a long-term effect?
See, Mehak, there is no strong evidence on this question. So, the earlier the baby contracts, logically, he'll be at risk of recurrent admissions and the prolonged illnesses baby faces, or the more the baby is admitted frequently, probably he will have a long-term impact. That's what logic says. There is no strong evidence to that. But if you talk of just babies less than 1 year, if baby is born preterm, definitely if you talk of a preterm, 18 times more at risk of being a wheezer or requiring some hospitalization during the first 2 to 5 years of age. So again, even in term babies also, compared to a baby who had not acquired RSV, if you talk of a term baby who has acquired, is almost 3 to 4 times more likely to be a wheezer. He'll have recurrent respiratory illnesses. And asthma also, there's almost 30% chances of having asthma after contracting RSV compared to a baby who doesn't have RSV. So, if you talk of preemie and term babies, both are at risk, but preemie babies are at more risk of hospitalization, death, and recurrent respiratory illnesses. But there's no age satisfied that data which you have the question which you have put up. There is no straightforward answer, but there is evidence that preemies are at more risk compared to term babies.
Okay. And a question related to that would be: are there any long term effects of RSV that may not be noticeable until like later childhood or adulthood?
See, there's evidence to it that babies who had RSV infection during early childhood, less than 1 year to 2 years of age, they have recurrent wheezer. They're present with recurrent wheezing episodes in the OPDs. They have recurrent admissions, and even as asthma also they have recurrent episodes till 6 years of age. Evidence shows that the same incidence actually decreases till the baby comes or reaches 12 to 14 years of age. So at 6 years of age, he is almost 3 to 4 times higher risk of having a wheezing episode compared to a baby who doesn't have RSV. But gradually over next 6 years, till the baby is 12 to 13 years of age, the risk of wheezing or respiratory illnesses actually decreases. Uh, People have tried to find out the cause of it, but logically there is no reason for that. By 13 years of age, RSV infected baby versus non-RSV infected baby is respiratory illnesses. So probably that immunological tweaking which has happened early on in the age, it modifies and gets corrected by 12 years of age. That's what the logic says. But this is what evidence is, and, and this is published in Lancet, and we strongly believe in that.
Okay. Uh, the other question would be, are children who have had RSV, are they more prone to other infections as they grow up older?
See, RSV doesn't lead to decreased immunity. So this again, it doesn't lead to severe infections. Only proven theories, it leads to some modification in the immunity or some toll-like receptors or some immune cells in the airways, due to which they become very prone to respiratory illnesses, particularly non-communicable illnesses like wheezing, I would say bronchodilators, readmissions because of non-communicable illnesses. Same time, if you have co-infections, suppose RSV is co-infected with some other viruses, there is evidence, there is data on that which shows that the prognosis actually and the outcome is really bad. So co co-infections actually leads to worse prognosis, but RSV doesn't decrease immunity and RSV doesn't prepone a kid to further infections. It leads to non-communicable respiratory illnesses. The rates become very high. Okay.
Got it. My last question for you would be, are there any preventive measures to reduce the risk of long-term respiratory issues after RSV?
First of all, preventing RSV infection itself. Suppose somebody has viral illness in the family and not testing for it. Basic measures like cough and cold, cough hygiene, like using a mask, using a hand sanitizer to prevent hand sputum spread of infection through the sputum, and basic cough hygiene like you need to cough or sneeze into your elbow or into a tissue. So this all will prevent transmission of RSV infection from one family member to the other. So that's the basic preventive strategy which any illnesses you need to take care of. Okay, and there is there are preventive medications or drugs which helps in decreasing the impact of RSV on short-term and long-term outcome. So if you talk of drugs or medications, there is anti-RSV monoclonal antibodies, which prevents hospitalization of preemie babies or babies who had long-term respiratory issues almost by 50%. Suppose a baby who has not been given an antibody compared to a baby who has been given antibody, the rate of hospitalization will come by almost half. That's a significant impact. And there are studies on that, on even the long-term impact also. So as I discussed in the first question itself, every
Yeah.
hospitalization, every respiratory episode, every illness will actually predispose the baby to worse long-term outcome. So giving antibody and preventing the short-term outcome will logically we will have a good long-term outcome. People have done randomized controlled trials in which they gave one group of the babies monoclonal antibody, and the other babies they did not give the antibody, and they've shown that the babies who received RSV monoclonal antibody, uh, the episodes of wheezing or recurrent respiratory illnesses actually significantly reduced. So probably that shows that uh, well conducted studies, which is an RCT, had shown that they have long term outcome, which is good. Probably preventing RSV and using RSV antibody in the right group of people, not to everyone, but yes, who was at risk of such illnesses like preterm less than 29 weeker or 29 to 35 weeker who has respiratory illnesses like bronchopulmonary dysplasia. You need to use RSV antibody at the right time, probably before discharge. That will have a good short-term outcome as well as long-term outcome also.
Sure. Thank you, Dr. Gopal, for sharing great insights on the long term complications of RSV and highlighting the importance of early symptom management and consulting a healthcare provider. So, to our viewers, we hope this session has been both informative and empowering. And we appreciate you for joining us today and looking forward to connecting with you in our next sessions as well. Remember, staying informed is the best way to protect your baby from RSV. Thank you, doctor.
Thank you, Mike.